You're listening to Green Medicine. Here's your host of Green Medicine, Dr. Jonathan Wright.
Okay, let's see. We got 3 minutes before the break at the end here, so I should shut up and listen to Dee. I don't know if I'll get your question answered right away, Dee, but I'll certainly do it after the break.
Oh, yes. Hi, Doctor. Thank you. This is Dee, and I'm a 77-year-old lady, and I was diagnosed with lupus 2 years ago for the first time. And then a year ago, I was diagnosed also with Sjogren's disease. Now I have 2 autoimmune diseases.
Oh, good. They can both be handled the same way.
Yeah. Handled the same way? Oh.
No, I'm not kidding.
Well, I do take hydroxychloroquine, 400 milligrams a day. Mm-hmm. Is there anything, and I'll just tell you my symptoms and then I'll let you talk. I have severe, almost at times incapacitating dry eyes. I take
that's another clue. Thank you.
I know. I take autologous eye drops 10 times a day, and they're made from my own blood. Now, that has helped. And okay. I have, since a year ago, since his Sjogren's started, and this is getting worse. Well, first of all, the lupus, I've had, very weak. I'm now very weak the past 2 years, and I lay down every afternoon. And then with the Sjogren's, I got a lot worse. A year ago, I have that makes dry eyes worse. And then I have a severely dry mouth, especially at night. And I'll use xylitol. It's like little discs you wear at night on the roof of your mouth, and then it dissolves. That's supposed to help with promoting saliva. But the taste is not good, and sometimes it just makes me nauseous. And then I use biotin products, toothpaste, and the doctor did prescribe Cevimeline for me. It's Cevimeline, and I took that a month, 3 times a day for a month, and it did nothing, so I stopped it. I only can sleep 5 hours a night. I used to sleep 8 or 9, and it's just not enough sleep for me. And I'm having a lot of anxiety with these 2 autoimmune diseases. Okay.
Okay, ma'am. We better get to our break here, and I'll get back to you after the break. Okay. Well, back to Dee. Are you still with us, ma'am?
One last thing you need to know is...
Thank you.
I woke up last night just gasping. It woke me up, and my mouth and my throat was so dry.
Yes, ma'am.
Yeah, okay. That's it, yeah.
Okay. Well, you said that you're too old to get pregnant. Is that right?
I sure am.
Okay, well, had you heard, ma'am, that when a woman with any autoimmune disease there is, including the two you're talking about, becomes pregnant, her autoimmunity just fades away, and she's no longer autoimmune until that baby is delivered. And then the autoimmune disease starts to come back, and it gets worse and worse unless she knows a physician who knows what he or she is really doing. You have to know somebody who's doing this for years with, guess what? Copying pregnancy with bioidentical hormones. And one other thing. Now, let me tell you about that, ma'am.
Okay.
The principal bioidentical hormone needs to be estriol. Estriol is a weak estrogen, but then we just use more of it because it's weak. But estriol is strictly anti-carcinogenic, plus Dr. Nancy Cicotti, a professor at a Southern California University, rounded up 6 women who were severely disabled with multiple sclerosis. They were in wheelchairs. They could scarcely do anything for themselves. She did brain scans on all of them. Oh, look at all those MS lesions. She put them all onto estriol, ma'am.
Yes.
And when they rescanned their brains in a few months, better than half of the MS lesions were gone. And these ladies are back in better shape. So all she did was mimic one of the things that happens during pregnancy, and that we can do with bioidentical hormones. Now, here's the other thing that happens to do during pregnancy that we can't mimic with bioidentical hormones, but we can mimic it all anyway, and that is some German researchers reported that endometriosis, which is also an autoimmune problem, Totally cleared up and disappeared. And am I yelling? Yes, I am. Totally cleared up and disappeared with no surgery, and the only thing left was a little bit of pain with urination. Other than that, no problems at all with injections of HCG. Now, HCG is human chorionic gonadotrophin. You know what that is. That's the stuff made by the placenta during pregnancy. And so not only did mother have a lot in her body, but the baby took a bath in it. And the baby never, ever got hurt with that. So when I'm working with somebody who happens to have lupus or Sjogren's or anything else autoimmune, she's usually a lady. I'm sorry, nature is unfair and unbalanced that way. And many, many more women get autoimmune disease than men. But very fortunately, it's been found. German researchers, Dr. Sakoti, do about it. So if we were working with you at the Homa Clinic, we would have you go on to bioidentical hormones, particularly estriol is the principal estrogen. We would not be using much at all of any of the other estrogens because one Jesus uses more estriol, like Dr. Sakoti did. Okay, second thing, we'd be using HCG. And funny thing, ma'am, but I personally, in my practice, all the doctors' practices at the Homa Clinic do much the same thing, but not exactly the same thing. It works against autoimmunity, whatever the problem is, like a son of a gun. Now, to go further with those bioidentical hormones, there's a research institute for eyes from New York City who published back in the early 2000s that you could clear up dry eyes completely. And why this isn't known out there in the medical community, I have no idea, except it's not patentable. We can't make big bucks on it by just having people supplement testosterone. Oh my goodness, another bioidentical hormone. Yes, they did. What they found is that the glands in the upper eyelids and possibly the lower eyelids, called meibomian glands, which make the oil that keeps the water in the eyes so they don't get dry, those glands are testosterone dependent. And that's why for every one man with dry eyes, you're going to see, again, 6 or 7 ladies with dry eyes. So I've worked with many women and just a few men with low enough testosterone to need it. With testosterone, it clears up the dry eyes every blinking time, man. So we got the estriol component of bioidentical hormones, we got the HCG component of pregnancy, we got the testosterone, and this is all published medical so-called literature, although compared to Shakespeare it isn't literature, but it is medical science. And why the doctors haven't learned about this is because none of it is patentable, ma'am. So anyway, you can get most of this just simply cleared up working with somebody who knows what they're doing with autoimmune disease. And what I mean by knows what they're doing, knows how it can be cured.
Wow. I'm going to make an appointment at your clinic. Because of this virus, are you taking patients at this time?
Yes, ma'am. And even though we're doing all the precautions and masking and all that good stuff, we still need to help people who are sick. So we're in business. Okay.
Which doctor in your clinic could help, would you suggest for me with these two? And yes, I have meibomian eye disease. I've lost 75% of my meibomian eye glands.
Oh, boy.
And then I have these 2 autoimmune diseases. So my quality of life is extremely poor. I'd like to know who you could recommend and where is the closest office to me.
Well, we have just one office presently. It's in Tukwila.
Okay.
I'm not sure where you are, but it's in Tukwila.
Okay.
And what I'd suggest we try to do for you is have you come in at the same time that 2 of our doctors are available. And why would we be thinking of doing that? And no, you wouldn't be charged for 2 doctors, just one. The reason I'd be thinking of doing that is this requires some long-term care, and my practice is so doggone full, so what I'd be looking for is myself and another doctor. We'd sit in together, and then that other doctor could work with you after that, and of course, since he was in the very first meeting, he would be fully informed, and then he could ask me questions if he needed to ask me questions, which I doubt, but he could ask me questions after that so we could make sure things go well for you, ma'am.
Oh, wonderful. And would I tell that to the receptionist when I make the appointment about having more than one doctor there?
No, I need to do that because they probably wouldn't believe it. We don't do this very often.
Okay.
But with everything you're putting up with and the fact that the remedies are just sitting there looking at us, this, as you can tell, does make me just a little bit annoyed because it should be very well known. If we went to medical school to get people better, we should keep our eyes out for stuff like this. So the person to call for, I'll shut up in a moment, ma'am. The person to call is my medical assistant. She does the bookings. Her name is Virginia.
Virginia.
You can tell her that, and then she'll come and ask me, "Did you really do that?" Okay.
Okay. I just made some notes. The doctors might tell me to take, you said, when I come into your office, it's H as in Henry, C as in candy, G as in go?
Exactly right, ma'am. And if you put those three in capital letters and put them into your computer, then you can read about the stuff. It's got this really long name called human chorionic gonadotrophin. But if we just remember, no matter what we read, that we all took a bath in it for 9 months when we were inside a mom, and our moms were exposed to a whole bunch of it too, it's that safe.
Okay. Oh, I forgot to tell you, I don't think I told you, I take hydroxychloroquine 400 milligrams.
Oh, no, you did tell me that, ma'am. You're getting a head start on the coronavirus, aren't you?
Yeah, I got a head start, didn't I? Yeah.
Yes.
Maybe that's the only good thing about what I have. Yeah, I'm on hydroxy, yeah. I don't have any side effects that I'm aware of with it, so that's a good thing. Yes, I have gone to multiple doctors with meibomian eye gland disease and blepharitis. The blepharitis is all cleared up, but I do, I do use Avenova. That's an eye scrub, and then I use, the autologous eye drops. Have you ever heard of these, the eye drops before made from blood?
Yes, I have, ma'am, and it is a good idea, but doggone it, this other material was published back in the early 2000s and about testosterone in eyes.
Yes.
And why nobody picks that up is probably because you can't patent testosterone.
Right. I agree. And I've had some doctors say, well, good luck with this. You've done everything you can, and I don't have any other help for you. So I've been out of luck. I've gone to about 10 doctors already for my eyes, corneal specialists, and I go to a dry eye clinic in Seattle once a year. I use the drops 10 times a day, the autologous eye drops. But thank God, before I took the eye drops, I started those 3 years ago. I wanted to die.
Yes, ma'am.
I wouldn't do anything, but it was that bad.
Mm-hmm. When you get all better, I suggest you go back and visit that clinic and tell them what the heck you did, because we don't intend to keep a monopoly on any of this stuff. We went to medical school to help people get better, and maybe we'll help some other people get better that way.
Yes, thank you so much, Doctor. I will be calling your office Monday, and I will talk to Virginia to make my appointment, and I'll tell her what you said.
And tell her I told her she'd be dubious, but that way she'll calm down.
Yes. Thank you, Doctor, so much. Thank you.
You're welcome, ma'am. Thanks for calling.
Have you heard about Tea Builder? Tea Builder contains 10 ingredients, each chosen because research studies reported that 9 of Tea Builder's 10 ingredients stimulates men's own bodies to produce more testosterone and or free testosterone. What does the 10th ingredient do? That 10th ingredient is nature's original molecular version of Viagra. Of course, Viagra is not only more potent, but also patentable, more expensive, and has potential adverse effects. Tea Builder, which helps men's bodies make more testosterone, is a safe, effective alternative, and it's not pricey. A 30-day supply, one bottle of 150 capsules, is $29.95. If your entire order is over $35, your shipping is free. Go to TahomaDispensary.com. That's TahomaDispensary.com, or call 1-888-893-6878 for Tea Builder, the formulation that helps men's bodies make more testosterone. Call 1-888-893-6878.